Hello everyone. Today we're going to be discussing biomedical ethics and cosmetic surgery. So when defining cosmetic surgery, it is important that different concepts relating to society, ethics, and healthcare perspectives are defined. The above views relate to how individuals and the society view of the concept of plastic surgery. However, when applying ethics in medicine, variance arises as a source of contention among healthcare practitioners and their clients. Biomedical ethics defines the decent values by which healthcare practitioners must conduct themselves whenever they interact with clients. Societal perspective consider the overall view of other people. Ethics relate to the prescribed moral reasons for performing a surgical procedure. Healthcare perspective relate to the advantages and disadvantages of performing a certain aesthetic procedure. First, the four core principles of medical ethics are the most efficient checkpoint for all decisions made in regards to plastic surgery and all other procedures. The four principles of medical ethics are beneficence, to do good; non-maleficence, to do no harm; autonomy is giving the patient the freedom to choose freely where they are able; and justing is to ensure fairness. The purpose of this presentation is to identify whether cosmetic surgery is morally justified. The basis of moral justification will mainly focus on the biomedical ethics. It further identifies various justifications offered for growth hormones administered to children. Cosmetic surgery. What is cosmetic surgery? Cosmetic surgery is to enhance an individual's appearance. The procedure are solely focused on the aesthetic appearance. Few examples of these common cosmetic surgery procedures are the facial contouring, breast enhancement, body contouring, skin and facial rejuvenation. In researches conducted so far, most individuals are after the surgical procedure due to medical reasons, appearance changing, fun, and lifestyle. To better understand this, it is better to weigh the possible positive or negative implications of such procedures with a view of ethics. The reasons why individuals seek cosmetic surgery could be linked to their underlying psychology. In early studies, up to 70% of individuals seeking cosmetic surgery were diagnosed with mild psychiatric disorders. It was clear that the perception of body image greatly influenced how individuals identify. It is important to note is the fact that human beings label certain body type as a good and others bad. This therefore causes a variation of the reasons for seeking cosmetic surgery, but primarily the reasons outlined in this slide are basic. Many individuals undergo cosmetic surgeries because of the benefits these surgeries have. The first and main benefit of cosmetic surgery is that helps to align your natural appearance with your desired appearance. If you want to undergo cosmetic surgery, it's reasonable to assume that you are unhappy with some aspects of your appearance, and you desperately want to change it. Once you do it, your appearance will change forever, resulting in an improved version of yourself. Other benefits too includes improved physical health, improved confidence, and psychological benefits. However, cosmetic surgeries also have disadvantages that patient needs to be informed about. Like for the few disadvantages for cosmetic surgery are the expense, chance of addiction, risk of death, and doesn't always meet the expectations. Medical ethics in cosmetic surgery. There are many justifications offered for the undertaking of a surgical procedure. Different moral theories could be applied to justify cosmetic surgery. These theories are utilitarianism, roles contract theory, virtue theory, and natural law theory. So the theories mentioned in this particular area are the ones that are mostly utilized by individuals to defend the reasons for undergoing cosmetic surgery. Utilitarianism holds the best action are the ones with excellent results. Natural law theory holds that right moral actions are determined through human reasoning. Virtue ethics prescribe that the character of an individual defines their moral values. And Rawls' contract theory prescribes that contracts among individuals are made for mutual benefits. Medical ethics is particularly relevant in decisions regarding involuntary treatment and involuntary commitment. Theory of utilitarianism favors cosmetic surgery because it underlays the result to justify the procedure. The patient ends up looking good. Rawls' contract theory, on the other hand, justifies that performing a cosmetic surgery is the purpose of a mutual benefit between the healthcare practitioner and the client. The client looks good, the healthcare practitioner gets paid. The moral accordance to most surgical procedure remained a challenge up to date with a tangible ambiguity. The natural law theory, when applied to justify cosmetic surgery, will dictate that reason takes precedence over all decisions made. This is to mean that the reasoning provided could be beneficial or detrimental, but whatever decision is made is not based on whether an action is good or wrong. So, ethical principles in cosmetic surgeries. The application of ethical principles in cosmetic surgeries could be used to justify why people undergo such surgeries. Often, cultures are diverse and perceptions of normal body features vary depending on individual needs and wants. The ethical principles of autonomy, beneficence, non-maleficence, and justice could be applied. These principles guide the medical ground for cosmetic surgeries. These procedures should be considered on adult people. This is because the idea of informed consent does not apply to children as they make unreliable life-changing decisions. To effect autonomy, the physician adheres to the decisions made by the client with little regard to the reasons why the client seeks surgery. The idea of beneficence applies when a cosmetic surgery is seen to provide the most benefits to the client. However, whenever a cosmetic procedure is perceived to cause more harm than good, it should be the role of the healthcare practitioner to inform the client of the risk involved. If necessary, the surgery should be avoided at all costs. Justice rarely comes up in cosmetic surgery. This is because most of these surgeries are performed on individuals who would otherwise lead meaningful lives. However, when considering how this procedure is, the issues of financing such a procedure are weighty. Plastic surgery, unlike cosmetic surgery, it is more of a medical approach. Plastic surgery does not focus on the aesthetic outcome. Plastic surgery repairs birth defects or deals with burns and disease. Few examples of surgery procedures are burn repair surgery, hand surgery, scar revision surgery, and lower extremity reconstructions. All these procedures are medically justified because they seek to restore the dignity of individuals. The practice of plastic surgery aligns more with medical ethic as it allows the healthcare practitioner to do good, ensure fairness, and avoid harm to the patient. It also exposes the patient to the responsibility of making more informed decisions about their lives. The advantages of plastic surgery are likened to cosmetic surgery. Just like cosmetic surgery, plastic surgery enhances appearance, improves physical health, improves confidence, and comes with psychological benefits. In reference, the moral guidelines in this profession, these procedures is largely accepted in most healthcare services centers. Even as it is medically beneficial, the ethical principles of autonomy, beneficence, and non-maleficence and justice should still apply. In addition, these surgeries are justified only when there is informed consent signed by the patient or medical proxy. The patient does not only seek treatment because of external pressure, but because it is a necessity to improve their lives. There are additional plastic surgeries that correct congenital malformations and are medically justified. This is because they enhance the quality of life of an individual. Here are a few examples: scaloplasty, surgical correction of the cleft lip; palatoplasty, corrects cleft palate; orchidopexy in adults is considered as cosmetic because it enhances the sexual life and appearance of an individual to partner. Ethics of growth hormones. The debate on its ethical appropriateness of growth hormones is still in the balance since the beginning. Gill argues that use of growth hormones in children should be considered abuse. Other scholars have argued that use of growth hormones enhances the body image of individuals. Some people argue that since short stature is not a medical problem, the treatment should not be approved. However, there are at least three considerations that are left out in this line of reasoning. First, the distinction between medical and non-medical condition can be understood in different ways. Second, medicalization refers to a broad understanding of a medicine. And lastly, medicalization does not necessarily mean pathology. Arguably, the definition of normal and abnormal varies. The different perspectives in medicine and society view short stature as different things. Medically, a short person may lead a normal, uncomplicated life. However, the society views such persons as outcasts and discriminate against them. The only benefit of utilization of growth hormones is body size increment. However, the harm that comes with the use of these hormones outweigh the benefits. For example, individuals that goes under growth hormone therapy are likely to develop hypertension, diabetes, and leukemia. In conclusion, healthcare practitioners utilize the four essential ethical principles defined by Fawn to chaperone decisions made in clinical settings, regardless of the complex ethical scenarios often faced within plastic surgery. The plastic surgery literature has a relative dearth of papers primarily focusing on ethics. As plastic surgery and other surgical fields to continue to advance with developing technology and surgical techniques, parallel progression in ethical reflection and discourse is still needed. Cosmetic surgery confines to the patient autonomy in its undertaking. The concept of justice and beneficence are only secondary because the client has already made their mind. However, the healthcare professional should not hesitate to alert the client on the risk that may arise when these surgeries are done. Plastic surgery is medically justified because it seeks to correct deformities that would otherwise impact the health of an individual. Cosmetic surgery, on the other hand, raises a lot of issues of contention. Different individuals justify it differently. The issues of using growth hormones and cosmetic surgery are highly contentious in regards to ethics. When these procedures are performed under the consent of an individual, it is important that the four ethical principles are adhered to. Thank you for taking your time and have a good day, everybody.